Slowly but surely with time, there's this gentler sense of self. There's this sense of I'm not so on guard for any kind of markers that might confirm the sense of shame or blame or reason to confirm this question mark within me that something might be wrong.
You might have noticed that there seem to be a lot of women who, just like me, are being diagnosed with ADHD in their 20s, 30s, and 40s. And there are a few reasons for that. But what might be slightly less known is that for a lot of us, the diagnosis process is a particularly emotional one. I think we're geared to love a label. We love to do the quizzes that tell us what our love languages are and whether we're an introvert or an extrovert. But for me, adding the label of ADHD made me question what I thought about my own identity. What parts of me were a symptom of a condition versus what parts of me were actually my personality was a question that I really found myself pondering. Today we wanted to have a chat about late age diagnosis and how that can make you question a lot of your past experiences. I also want to get into the crossover of ADHD and other mental health conditions and why so many of us are diagnosed with anxiety disorders. Joining us today is the wonderful Dr. Kieran Kennedy. He is a psychiatrist who specialises in adult ADHD and mental health conditions. He's a Kiwi and he gained a specialist psychiatric fellowship in Melbourne. Now, before we do get into it, I need to outline the legal stuff. This chat with Dr. Kieran is not designed to diagnose you. It is general in nature and designed to be for educational and entertainment purposes. It is not intended as a substitute for the advice of a physician. Dr. Kieran, welcome to Cloud.
Thank you so much for having me. It's so good to be here. I'm really looking forward to diving into it.
Kieran, can we start with what led you to wanting to get into psychiatry and how you ended up specialising in adult ADHD?
Yeah, really good question. Sometimes I ask myself the same thing. So I guess no surprises in terms of my dulcet tones, but I am originally a Kiwi boy. So I grew up in New Zealand, actually. I grew up on a farm. So just from a really young age, loved being outdoors, loved animals, loved being around people. I have always been a people person. So I think moving towards medicine and helping people and talking to people every day, I sort of always knew I was going to do something along those lines. But actually, interestingly enough, before medicine, I was actually a bit of an arts boy. So I loved music, drama, writing. I did a lot of writing as a kid and a teen. And so I think then when I discovered biology and science and fell in love with those things, for me, medicine and then especially psychiatry, I guess after I popped out of medical school, was always this just perfect mix of sort of science and art. And as we're going to talk about when it comes to ADHD, yes, there's symptoms and treatments and medications and neuroscience, but especially psychiatry is this beautiful mix of, feelings and messy emotions and gray zones and talking to people about their fears and their dreams and their relationships and all of these things. So I think for me, becoming a psychiatrist was pretty clear cut from early on. I did psychology before medicine, actually. And yeah, since then have sort of popped out the end and done a few things as a psychiatrist. But, working in ADHD and with neurodevelopmental conditions is something I've moved into and just really, really love because of that balance of art and science as well.
I really love that. What ended up making you specialise in adult ADHD in particular?
A little bit of a fall into ADHD in some ways.
Often how the best things happen.
I was just going to say that. I completed my psychiatric training in Melbourne and worked for quite a few years at the Alfred Hospital and actually did my subspecialty of psychiatric training in a lot of neuropsychiatry, actually, and what we call liaison psychiatry, which is this beautiful, super geeky, fascinating interface between the brain and physical health and psychiatry and mental health. And so that obviously always led me to have an interest in how the brain is particularly involved in our mental health, and following completing my training moved into private psychiatric work and actually, as we'll come to talk about, started to see a lot of people presenting with questions around neurodivergence and ADHD, and that led me to also really dive into a lot of those questions and just loving that work, especially with again that neurodevelopmental kind of connection. And so it's sort of been for quite a few years now that I've been working predominantly in ADHD diagnosis and treatment, but also neurodivergence for adults in general as well. It's been diving into experience and working with a lot of patients, but also a lot of research and of my own study as well. So it's a really fascinating area that I have weirdly ended up kind of segueing into, but actually, again, it just hits all my sweet spots and I really love it.
It's funny, the whole idea of this ADHD, diagnosis and talking about it, it is very much labelled as the trendy thing to do. And as we spoke about in the previous episode, it's the number one thing that made me reluctant to talk about it publicly because I know that people are eye rolling. I know that a lot of them think, oh, this is something that you think makes you so unique and quirky. And I kind of think of the MySpace days where everyone glamorized anxiety and depression. And I wonder whether that kind of seems to be what's happening now, maybe 10, 15 years later with ADHD. So why is it that ADHD seems to be so trendy now?
Yeah, I mean, I think that is the question on everyone's lips at the moment, right? And I think there's so much out there at the moment about ADHD, and we're seeing people get the diagnosis, get treatment. They're talking about it on their social media accounts. It does seem like it's everywhere. And in a way it is. And I will be devil's advocate and say, I think in terms of social media and awareness, there can be a real double-edged sword for mental health conditions, but any health condition. And I think for ADHD, it's ultimately such a positive thing. And obviously, as a psychiatrist working in this area, I'm of course going to say this because it's such a positive thing that there is so much more out there now about adult ADHD. And there is a lot out there now at the moment around this being a trend or being a fad. And I know, speaking to patients every day, that this is something that actually worries people and is actually often blocking people from getting a diagnosis or treatment or talking about it if they had, because sometimes it is made to feel like this must be a trend or a bandwagon that people are jumping on, or dare I say it, a fad. And obviously, just to put it out there, as a psychiatrist, I will, push back on that and say that is absolutely not the case. This isn't just a trend or a fad. And I think for adults in general, but especially women, we're seeing a lot of people presenting for adult ADHD because, again, ADHD was something that historically was really geared towards and around children and adolescents. And that's where the concept of ADHD first started. ADHD is what we call a neurodevelopmental condition or disorder. And so that means, the crux of it is that it's something that is within us and present across our development. And so even for adults with the diagnosis, as you probably know, Keisha, part of the assessment and the whole process is looking back sometimes painstakingly around what was there as a child, what was there in school reports, what did parents or other people notice. And so this is something that's with us, but we now know and we've come to see that up to 60, 70, even in some sort of research, 80% of children and teens with ADHD will continue to have significant ADHD symptoms as adults. Whereas the older conceptualization of ADHD was that this was a childhood disorder, this was a condition that affected kids and little boys in classrooms. It wasn't something that affected adults significantly later in life, and it especially wasn't something from that more stereotypical classical view of ADHD. It especially wasn't something that affected women or even girls, and so I think our concept around ADHD in terms of how ADHD presents slightly differently for girls and boys and for men and women, and for people of all genders, that's something we've also really learnt more about. And I think women, thankfully, are learning more about that too and becoming aware. And that is what is the major part and factor, I think, to a lot of women now in later life, realizing this and presenting for assessments or help or diagnoses.
It's really funny you mentioned the school reports. For a part of my diagnosis, I did have to dig through some of my old school reports. And
fun.
It was it was a very, very emotional thing for me to go through. And that might sound so over the top to a lot of people, but the thing that I got really frustrated with, and I've later had to kind of unpack the reasons as to why, is because I was reading the comments from every single one of my teachers. like she has potential, she has academic potential, but she doesn't know how to apply herself. She distracts others. There was comments like, I jeopardize other students' learning capabilities because I'm constantly talking to them. And to me, I thought, how did none of you pick up on something like the fact that this is what I was experiencing? And it made me feel very emotional thinking about the fact that if it had have been picked up at the time, maybe I wouldn't have developed such a large sense of self-criticism. Maybe I wouldn't have felt so much shame around a lot of my behaviors. And I think I've had to put that to bed because exactly as you spoke about, our understandings of what ADHD is have evolved.
100%.
And I don't think it's fair for me to apply our current understandings to, my parents and my teachers, and mum, if you're listening to this, I'm sorry. I know that I had a couple breakdowns to you and questions like, why didn't you pick up on the fact that this is what I was going through? So can you list for us what are some of the most common symptoms between boys and girls and what are some of the most common symptoms of undiagnosed, particularly adult women?
100%. I think it's important to outline that sex and gender can influence obviously our health and our mental health, but also not necessarily, and so there's no hard and fast rule here. But we do know that for ADHD, particularly in girls and also then later on in women, it's more likely for there to be the inattentive symptoms that might be predominant. So rather than girls in the classroom presenting with hyperactivity or disruptive behavior or being on the go 24/7, these very classical kind of more hyperactive, impulsive features of ADHD, for women and girls, we now know, and I see just a lot in clinical practice as well, that it is often those more internal, sometimes often more subtle features of inattention around retaining focus, not being distracted, procrastination, organization, time blindness. These things are what we're sort of seeing girls and women often present more with. And I think it's important to note down that there may very well be biological reasons for that within the brain. But I think it's super interesting as well for us to call out the fact that socialization and gender pressures here are super important as well. Girls are obviously reinforced in multiple ways, back in prior decades, but still now, to be quiet, to be good girls, to not be disruptive,
100%.
to not be overactive or boisterous or loud. And so there may be elements of that hyperactivity and impulsiveness that for boys, teenage boys, men, is just socially more acceptable in a way to be shown or expressed. Whereas for girls and women, those same things might be kind of corralled down avenues where they become less evident or overt, or they're held internally more. So I think for women presenting, a lot of what I see is the inattentive side. Women who have long struggled with a sense of organizing their thoughts and their time and their external space, struggles with distractibility and focus. But also, interestingly, women who have internally felt a struggle with impulsivity or restlessness or fidgeting or talking, as you mentioned with those school reports, Keish. I talk to a lot of women who have found it exhausting over the years to try and contain those symptoms or talk themselves around the shame and embarrassment of those symptoms, because that's not quote unquote, and for anyone just listening and not seeing us on the screen, I'm using my fingers in the inverted sort of quotations here, because that is not what a good girl does or presents with or shows.
Yeah, and I think I had this conversation with one of my friends who was more recently diagnosed, and she was speaking with me just before her diagnosis, and she said, I just never considered myself as someone who might have ADHD because, I joke that I'm really lazy. I joke that I am really unmotivated. And I said to her, look, something that my psych said to me is that a lot of the time the hyperactivity, it might not be external, it can be inside. Like it can be this traffic in your brain that there are just too many thoughts going on at once. It's really overwhelming. And from what I understood, you're the doctor, do not take my medical advice. But I've listened to and I've heard a lot and read a lot about it being a real reason that a lot of women in particular who are undiagnosed experience anxiety and are potentially misdiagnosed with other psychiatric conditions. For me, it was a bit of an all-inclusive, got a couple labels at once.
One-stop shop, which is common.
So, yeah. Can we talk for a second about what the differences between hyperactive, inattentive, and combined type ADHD are?
Definitely, really important. So, ADHD, we now know, can present in several different ways. We know that for some people, there is a predominantly inattentive form of ADHD, and that's when most of the symptoms that are present and the functional impacts in our day to day life of those symptoms are around attentional features and symptoms. And that might include struggling to focus, struggling to maintain a sort of single thought stream without spiraling and jumping everywhere, kind of as you just described. It might be issues with procrastination. It might be struggling with attending to details or not making mistakes, even taking in information in conversations or when doctors are rambling on podcasts and things. It's the attentional internal side of symptoms that is predominant in an inattentive ADHD. The hyperactive impulsive form of ADHD is when the predominant symptoms are more geared towards hyperactivity within the body. So there's significant restlessness and fidgeting. There's a sense of I cannot physically stop or wind down. I need to be physically active all the time. There are struggles around sort of maybe inappropriate or disruptive behavior or speaking or blurting, interrupting others, and then impulsivity is part of this as well. And that can, for adults, come in the form of choices. It might be picking up hobbies really quickly and impulsively. It might be with spending. It might be with alcohol, drugs, other things that are dopamine kind of oriented. And then the combined type is when individuals have a significant amount of both of those things. And so there's a presentation which is a combined form of mixed inattentive and hyperactive impulsive symptoms.
I'll let you guess which I am. For anyone listening, I was diagnosed with combined type. Something that I guess I've had to try and park my ego at the door with is that often when I hear anything about ADHD, I hear everything about the problems that we have. I hear that we have a problem with attention. I hear that we have a problem with interrupting, that we have issues with time management and being places on time and remembering things. And I think it's so intertwined with so much shame and so much guilt. I think that develops over the course of your lifetime. When you are told from very, very young ages, you are the kid that is interrupting. For me, it was literally, like I said, jeopardizing other students' learning capabilities. When that happens to you for such a long period of time, I think you can really develop a sense of like, oh, I'm not a good person. But for me, it really manifested in ways where I would forget my friends' birthdays. There was actually one year where I called my mum for a chat and I didn't realize until 2 days later that the day I had called her was her birthday. And I had completely forgotten about it. And I had to call her up again and just say, I'm so sorry. A lot of people in my life have assumed that me forgetting things like that meant that they weren't important to me. And I never felt as though that was true. I remember trying to explain to them, no, I care about you so deeply. This is a me issue. And I always apologizing for making them feel as though they weren't significant enough for me to remember.
Yeah.
Something I've learned to try and focus more on are the good parts of ADHD and not focusing so much on the problems. So what are some of the good parts of having ADHD?
Yeah, I absolutely love that. Just to start, because I think it's so important to call out the amount of sort of shame and self-blame, struggles with self-esteem, self-worth, all of these complex psychological kind of things that mix with an ADHD diagnosis.
Is there research on that?
Yeah, there is.
What does it say?
So it shows that sort of those with undiagnosed ADHD and even diagnosed ADHD often have significant sort of struggles around self-blame, shame, self-esteem, self-worth, even that connecting to elements of social anxiety, for example. And it was just as you like beautifully described there, Keisha, it's often because on a conscious but especially subconscious level, there's kind of this lifetime of collecting little indicators around us that we use to gauge a sense of self and a sense of worth and a sense of comparison to others. And so if, as you say, there is a sense from school reports or parents or teachers or friends or partners that we are dropping the ball, that we're too much to handle, that we've forgotten something important, that we're not doing as well or keeping up as much as other people around us are, there's this little, often subconscious sense that builds and builds and builds over time of something is wrong with me and I'm not as good as or worthy as, or if we go really deep with it, as lovable as other people around me. And there's this sense of there's something defective and wrong within me. And that can obviously affect our self-worth and esteem, but it can also then, in that steam pot down there, come out the sides as anxiety, as depression, and it can mix with those other conditions as well. But I do obviously want to call out that there are obviously positives and some real blessings with neurodivergence and ADHD, just as there is with, our neurodivergent cousin, autistic spectrum disorder. These are spectrums of features and conditions that we are all along on some point of the spectrum. And these things don't necessarily, I think, have to be seen as weaknesses or defective points or symptoms of disease necessarily. I think a lot of people with ADHD, but any form of neurodivergence, there's links to creativity, there's links to periods of hyperfocus with extreme interest and smashing out incredible work. And there are obviously elements to someone's personality and ADHD symptoms that those around them love, of course, as well. So I think it's really vital for everyone listening, whether you're someone with an ADHD diagnosis or someone who knows or is supporting someone with it, to know that this is not any sense of kind of something that is wrong or defective. It's us all being dotted along points on a spectrum. And I guess for psychiatry and mental health conditions, we would classify something as a mental health condition or quote unquote a disorder when those symptoms are at a point where it's causing distress or mental health impact to someone, or it's impacting your life in a way that is obviously holding things back, negatively impacting things, impairing things. But we should not see the actual condition as itself as just a blanket negative or a defect in my eyes.
Interesting. So for me, I mean, a lot of my algorithm, which will be of no surprise to anyone who has ever searched anything ADHD, as soon as you do, it will be flooded with ADHD content. And some of it is absolutely fantastic. I do question, like you mentioned briefly before, how much of it is evidence-based and how much of it could just be anecdotally. People with ADHD have maybe noticed these things. And some of the things that I've really enjoyed, I don't know whether they're true or not, but one is that people with ADHD tend to be really good in a crisis. I don't know why that is, but that is something that I've heard. And another is that they can have this kind of like sixth sense. And I do wonder, I saw this particular video on the ADHD Chatter podcast Instagram. It essentially said people with ADHD can have this sixth sense. If someone with ADHD tells you not to trust someone or that someone is, dodgy or whatever, you should trust it. And I really sat and I thought about what the reasons for that might be. And I think I landed on the fact that when you have ADHD and a lot of your behavior as you're growing up is not liked by people, like the interrupting, the talking over the top of them, being distractible or whatever, I think you can kind of learn to look for signs that your behavior is accepted in whatever group you're in, whether the people around you are liking you, whether you're fitting in, whether you're doing what they want you to do. But I thought it was a really nice side that maybe those skills that I developed in a way to try and sense social environments maybe actually could be a really good thing. And I should trust my intuition more because I've developed the ability to sense whether behavior is right or not.
Absolutely.
Does that make sense? Or is this just super woo-woo
No,
with
it
me?
totally
Okay.
does. And I agree. I think maybe that's a beautiful example of something that's online or that people have been talking about on Insta or TikTok or wherever else, that is kind of something people can connect with, and that makes sense. I agree. I think we're going to move on to talking potentially about sort of rejection sensitivity and things, but there's an element here of, as you say, ADHD impacting how we see the world, interact with the world, but also then flowing on into elements of our psychology and how we learn to have to read things that can make things challenging, but also, as you say, can actually lead to real skills and intuitive sort of pieces to how we go about the world as well. So I think it's so important for people to know this isn't a blanket negative. This isn't a defect within you. It's something that can have real strengths and positives, obviously, as well.
Something else I have thought about in terms of what you're speaking on, and it was actually the most surprising part of my entire diagnosis. The reason is that I genuinely did not know that other people experienced criticism in a different way to how I did. It is labelled rejection sensitive dysphoria. Can you tell me what that is?
Yeah, so rejection sensitivity or rejection sensitive dysphoria, it's a concept around really often reading and almost scanning hypervigilantly the environment for signs of acceptance from others or potential for rejection or abandonment. And it comes with an intense, often almost crushing, even physical sort of reaction to obviously when that happens, but even when sort of potential rejection or abandonment or negative sort of feedback or appraisal from others comes around. And rejection sensitivity and the dysphoria around that can come from many different places. That can also often be part of trauma or complex trauma for people, can also be part of anxiety conditions or mood disorders as well. But we know that it can significantly often be a part of adults presenting with ADHD, and that is likely to do with ADHD itself, but also, as we've been talking about, especially I think a lot of women who have grown up with undiagnosed ADHD, there is that sense of internalizing blame and shame and having to monitor people and the environment around us for whether we are acting in the right way, whether people are accepting and pleased, whether there's a sign that they aren't pleased, whether they might reject us. And that can often sort of drive this intense sort of sense of focus on that, but also the sensation of that being absolutely cutting and crushing if there's even a smidge of that potentially seen from the other person or the room around us. And I think for people that do experience it, it might feel mind-blowing, just as you've said, Kish, to consider that not everyone thinks about those things or feels potential rejection or negative appraisal in that way. But absolutely, we know for a lot of adults, it's something that often comes alongside and with a diagnosis of ADHD.
I had absolutely no idea that other people didn't experience this almost like hyper emotional response to perceived criticism. Especially, I didn't realize that it was perceived criticism. I actually thought it was criticism. There was this one thing that happened within work, and I don't know whether Laura will mind me telling this story or not, but she has spoken with me about it after being diagnosed because it was the biggest contrast that she has seen in me working for her. Because again, these things that exist within us, it's not only us that experience them, it's the people around us. And I think that there's a lot of shame inbuilt with that when you do get diagnosed because you have these realizations, holy shit, my behavior has actually been impacting all these other people as well. And for me, that took a little while to almost like forgive myself for and apologize for. But you guys might have seen on Life Uncut, we often post stories that are made in Canva for every episode. And Laura used to be a graphic designer, so she's really skilled in that area. I am so not skilled in graphic design. Thank God for Canva because it kind of like fills the gap and it makes it manageable. But essentially, Laura will create a template for me in Canva. And my job is for every episode is to go in and I change it to suit the particular episode that we're publicizing. There was this one moment where Laura asked me, we were sitting in a group and she said to me, she's like, hey, honey, I need you to know that if things are aligned left, they all have to be aligned on the left. You can't have things left and then some of the text be centered in the middle. And I went, oh, okay, no worries. All right, I'll change that. And she stopped and she kind of looked at me and she giggled. And she said, I just want to bring your attention to this because I remember 6 months ago we had something similar. And when I said to you, hey, I need you to do this differently, you're not doing it right. Your response to me was, you know that I'm not good at this. You know that I'm not trained in this area. How can you possibly think that I'm going to do this as well as you are because you're skilled and I'm not skilled here and who gives a fuck anyway? That was the contrast in my response.
Wow.
And for me, it wasn't I put it down to medication. I think that it has a lot to do with the fact that I've had more awareness. I feel this better ability to zoom out now.
Yeah.
But that for me was the biggest, it was this insight that I was like, oh my God, I did not realize that I used to be so sensitive to the smallest amount of feedback for something that it has nothing to do with my value. But at the time I was really like, oh man, I try so hard to please you. I try
Yeah.
so hard to do everything the way that you want me to do it, and now you don't think I'm doing a good enough job. And I would just ruminate on this really quite awful narrative
Yeah.
about what my place was in the team, you know?
Absolutely.
It's just funny for me the only reason I bring up that example is in the hopes that for someone who maybe hasn't been diagnosed with it, or maybe doesn't even know what rejection sensitive dysphoria is. I didn't either. And life is a lot better on the other side.
Absolutely.
When
And
you start
thank
to
God.
learn that maybe you do have this kind of hyper response to
Mm.
criticism. And for me, that has been one of the most relieving parts of being diagnosed.
I think one of the most beautiful things that I find with working with adults in the ADHD space and the neurodivergent space is just this sense of slowly but surely with time, there's this gentler sense of self. There's this sense of I'm not so on guard within myself deep down for, any kind of markers that might confirm the sense of shame or blame or reason to kind of confirm this question mark within me that something might be wrong, and I think it doesn't necessarily have to be an ADHD diagnosis, but any kind of mental health diagnosis. I think there can often be this sense of this relief, like this letting go of a sense of there is something wrong with me as a person and foundationally wrong with me being worthy of others or good enough for others. And I think alongside the improvement in ADHD and things like medications and other treatments, as you say, I think it can often be that deeper letting go of a sense of blame and shame and being kind of kinder and gentler to ourselves that actually weirdly reflexively then means we are not so reactive to perceived signs of sort of our worth being questioned or called into court type thing. So
Yeah, right. So in clinic, do you have a lot of patients that you will see initially undiagnosed and then maybe a year or two later? Like, what changes about their life? What are they telling you?
yeah, I see a lot of people who have this really often quite profound sense of just a change in how they see themselves and see their lives. And that's obviously one of the most rewarding things working in this area and working as a psychiatrist in general. But even the gap in time, which can sometimes even maybe be a month of the diagnostic session and then maybe catching up with someone again to discuss commencing medication or other treatments or checking in on how those things are going regularly, you can see this sort of progressive sense of a letting go of some of those things we've held and feared for so long. And I think one of the most common things I hear from people is this sense of it's been really emotional. Like it's been really emotional in a positive way, but it's been this sense of kind of like letting myself off the hook for all these things that I've held for all these years and kind of understanding myself in a gentler, more compassionate kind of way. And I think that's one of the biggest things I notice, hopefully alongside also procrastination and focus and things improving. But, I think it's often that sense of self that changes as well.
I very much relate to that unpacking of, your past narrative and just being a bit softer on yourself.
Mm-hmm.
And I think that could probably be where we wrap this episode up. The great news for everyone is that this is not the last time Dr. Kieran will be joining us. He is also going to be joining us on a later episode to talk about the causes of ADHD, the current theories of what's going on inside of our brains, medication, and how the diagnosis process actually works. It can be very confusing, and it is also not, in my experience, uniform across every psychiatrist and how that all works. So that will be coming in a further episode. Thank you so much for joining us. Thank you for your insight. Thank you for your expertise. And thank you for your kindness. It's really beautiful to talk to a psychiatrist who seems to very inherently understand the female experience with ADHD.
Such a pleasure. And so thanks for having me. And like I say, keen to ramble on the next one. So looking forward to it.